Hey friends, it's Dr. Frank at P. Frank MD, and today we are doing a unique treatment with neuromodulators. We're actually treating grinding or teeth clenching. This is a treatment that is multifaceted. It not only can be used aesthetically to change the shape of the face from more of a square, jagged look to more of a rounded look, but it could also treat migraines, TMJ, clenching, grinding of the teeth. This is a big problem for patients. Both with chronic dental work or pain that they can get from the TMJ. And also we could use it for facial contouring. So today we have a young lady who newly over the last couple of years is suffering from migraines and tension from chronic clenching. We're gonna take a look here in terms of, turn your head to the side here, Cal. This is really the muscle group of the masseter. Her pain often radiates up until the TMJ area. There also can be tension in the muscles of the platysmal band. So often we're treating this area for facial shape up towards here for migraines and TMJ. And if you find there's recruitment of the muscle, we're gonna treat some of the neck bands there. This is her first time doing this today. So usually we start at a moderate dose. You could use all the neuromodulators. I like Dysport in this area because it tends to spread a little easier. And this is something where I'll follow up with the patient about 2 weeks later. We do small amounts at a time until we get it right. It's very rare and it should never affect the normal chewing motion, but it should be able to not only decrease the clenching, but also the significant pain that's associated with it. She tends to get migraines that are focused in this area, and she should see relief with the first treatment. Maybe a few weeks later, I'll give an additional touch-up dose. So we're gonna start with the treatment here. Let's get a little bit more light on the situation. What we're gonna do is I'm gonna move you this way, okay? And often what I ask the patient to do is I ask them to just clench, good, and you may or may not be able, now relax, clench, it's a very strong muscle here, she's gonna hold that, good. I mean, it doesn't tickle, but it shouldn't be torture. It has to be placed right in the belly of the muscle, and then because she has a little TMJ issue, you can see the muscle work up there. I really treated this area, okay? So that's fine. We're gonna treat the other side, turn all the way this way. Give me a good clench. Oh, look at that, relax. Give me a good clench, hold it. Again, I'm gonna go right into the belly of the muscle. There are certain precautions that you have to have. You have to know what you're doing. You don't want to affect the muscles of mastication or chewing. There's also a very important muscle, the risers, that affects the smile and mouth motion. So this is more of an advanced treatment. This is not an area that is a beginner treatment for people using neuromodulators, but it happens to be one of the treatments that gives such a surprisingly great satisfaction for patients who are suffering from clenching, from teeth grinding. People end up wearing bite guards for this condition. They grind their teeth, they need major amounts of dental work, and I could say in 20 years of practice and maybe 15 years of doing this, I've never seen one patient that wasn't like a home run result if it's done right. So start slow. See the doctor every 2 to 3 weeks after until you get the maximum result. And again, like any other neuromodulator, it's something, depending on the severity, can be done a few times a year. And in as little as 4 or 5 days, you'll see a great result. So check out our IGTV, more about use of neuromodulators, grinding, and TMJ, and visit us on our website at pfrankmd.com. Thanks, gang.